I think most people from now to the end of the year are going to be thinking about health care. The sign up for the exchanges starts in about a week, or actually it's about 5 days. Also, you made the recent announcement to accept federal Medicaid dollars, and you want the Healthy PA program to take over and to put that money into use for that. We're going to get into the details of that in a bit. But first, I have to ask you, is this a reversal of the position that you've had for more than a year to not take that money?
Well, my position was I wasn't going to expand Medicaid and expand an entitlement program. And we still are not expanding an entitlement program. They are offering this money. We are going to apply it to this newly eligible group because that's what they've added, a new eligible group. We're not going to run it through the Medicaid program if the federal government agrees with us. We're going to run it separately for that group. We'll provide them the money, and they can buy their health care on the federal exchange. And we will have certain conditions involved, just as we want to reform Medicaid first in Pennsylvania and have to have the approval from the federal government. Some of those restrictions or changes would be, number one, that they pay a small premium monthly. You and I pay a premium every month.
I contribute to my health plan.
That's exactly right. And by contributing to your health plan, you are involved in your health plan. You try to keep your health care costs down. And as you know, in this day and age, we're doing more and more to keep our health care costs down. You're encouraged to do that. We in state government are encouraged to do it. And we can reduce our premium by taking healthy actions. Well, we want to do the same thing. So we have recommended and put in our plan that people up to 133%, which is this new category, on a sliding scale based upon income, would pay monthly no more than $25 a person or $35 a family.
That's 133% of the poverty level, federal poverty level.
That's exactly right. So, some people would pay less, some people would pay more. But there you are now invested in taking care of the cost of your health care rather than just having it as an entitlement program. In addition to that, this is, and you've heard the president say it a number of times, this is for the working poor, and we believe it's a good program for working poor, but there are certain members that are not working, and we would like to help them find a job, get a job. If they don't have the training for it, we're going to work on getting them the training, but we think there should be a job search requirement.
And what does that mean? What do they have to do to fulfill that?
Well, right now, unemployment compensation has a job search requirement, and we've developed the software and a program at the Department of Labor that people can go online looking for a job, and we'll know who's looking for a job and who isn't.
Does it require them to apply for jobs, or you just need proof that they're looking for jobs?
Well, we have to get the permission from the federal government first,
right.
But we're going to follow up with them. Did you apply for the job? It's one thing to say, okay, I looked to see if there were electrician jobs in central Pennsylvania or if there are sales clerk jobs in central Pennsylvania. It's another thing to actually go and make the application. And as you well know, many times applications, not all, but many times applications can be done online. So we don't think it's too much of a burden on the people of Pennsylvania who are able-bodied to be able to go out and do that, because the whole goal is to find them a job where they can get off of this program. If they're on Medicaid, get off Medicaid, get into the workforce, and get into a program that is provided by the employee or the employer at the same time. So those are the really two goals of that. Now, those people who are sick or disabled, if they fall into that category of the newly eligible, and certainly children, that wouldn't apply to them. Or mental disabilities, it wouldn't apply to them. But to those who can work, and I think it's reasonable for the taxpayers to ask for those who can work to go and look for a job.
You mentioned that you need federal approval for this because
right.
It does stray from the original intent of those dollars to expand the Medicaid program. We've asked that our Medicaid program be reformed also. I think we've talked about this on a previous show. We have the second most expensive Medicaid program in the country, almost twice the national average of what's out there. Many of the portions of our Medicaid program are optional for the state, and over the years, the state has gotten waivers from the federal government to add in these additional programs.
we can't afford to continue to do that at this point in time, especially if we're going to have enough other money for other projects that other duties that we have around the Commonwealth. So we've asked the federal government to allow us to make our Medicaid system much more consistent with what the rest of the nation is doing. At the same time, the search requirement and the requirement to pay a modest premium at this time. And I think the people of Pennsylvania, particularly the taxpayers, agree with me on that.